I'm Krystal Davis, the founding president of Texas Rare Alliance, where we work to make Texas a state of access for nearly 3 million Texans living with a rare disease. Thank you for the opportunity to advocate for protecting and improving access to accelerated approval pathway treatments. I want to start by sharing how our family joined the rare disease community. It helps explain why accelerated approval pathway treatments are important to me, the rare disease community, and the greater patient community. In July of 2011, doctors whisked our newborn son Hunter to the NICU at birth. Hunter had respiratory failure. He had tubes coming from everywhere and a ventilator breathed for him. Doctors successfully extubated Hunter after a couple of days, and we took him home from the NICU after 11 days. We thought the worst was behind us. However, Hunter lost nearly all movement around 2 weeks of age. At one point, my husband asked if I had shaken Hunter. I could never hurt our baby, but he was hurting. Doctors diagnosed Hunter with SMA when he was 8 weeks old, and our world forever changed. SMA is like ALS in babies. It robs the ability to move, swallow, and ultimately breathe, and is the number one genetic cause of death for infants. A doctor told us there's no treatment and no hope. He advised us to take Hunter home and enjoy what time we had left with him, which he expected to be around 3 months. We couldn't afford to listen to the doctor's advice. The stakes were too high. With the help of a researcher, we manufactured a compound in the US and took it to Mexico for a trial. 8 weeks after his diagnosis, Hunter was the first SMA patient to receive disease-modifying treatment. Hunter is now 10 years old. Today, let's focus on the FDA-approved SMA treatments in the US. The FDA approved the first treatment for SMA, an antisense oligonucleotide, or ASO, on December 23rd of 2016. Although it was a couple of days early, it was the greatest Christmas gift the SMA community could receive. Doctors could never tell SMA parents again that there's no treatment and no hope, to take their babies home and wait for them to die. Now, with pre-symptomatic and early diagnosis, babies can grow up as average children, running, walking, and playing freely with their friends, instead of being tethered to machines that monitor, feed, and breathe for them. The thing is, the ASO treatment, the gene replacement therapy, and the small molecule medication the FDA approved are all accelerated approval pathway treatments. As wonderful, even miraculous, as these treatments are, we've seen both private and public insurers take longer to develop coverage policies to include them in formularies. Innovative treatments can only help patients when patients can access them. Many of these treatments are for the rare disease community. The Oregon Health Authority proposed renewal of the 1115 waiver that greatly reduces access to accelerated approval pathway treatments. We know that accelerated approval pathway treatments are under attack and facing greater payer scrutiny than ever before. This means that patients like Hunter will have reduced access to the treatments that save and improve their lives. It means we'll shift from paying for lower cost, high value treatments that keep patients home with their families and return to paying for a higher cost, low value, emergent and critical care where patients are in emergency rooms and critical care units instead of being at home with their families. That's unacceptable in any context. When you add how the pandemic has taxed hospitals repeatedly, we can see how reducing access to accelerated approval pathway treatments would overburden and negatively impact our healthcare system. We're going about this all wrong. We need to treat rare disease patients with the dignity they deserve in providing access to accelerated approval pathway treatments. We can't afford a healthcare system that picks and chooses the patients to receive treatment because that would morally bankrupt our society. Dr. Krystal Austin, former NCATS director, has stated that rare diseases represent one of the largest public health crises we face, yet are mostly ignored. We must act faster and treat more patients. The FDA started an accelerated approval program because it recognized and understood the importance of providing early approval for drugs that treat serious conditions with unmet needs. Let's reframe how we think about rare diseases and other conditions with accelerated approval pathway treatments. Think of all the times we step up and act swiftly following natural disasters for hurricanes, earthquakes, tsunamis, floods, and wildfires. These humanitarian endeavors recognize the inherent worth of human lives. Rare diseases are a public health crisis that impacts the patient, family, loved ones, and community. Rare diseases are a public health disaster. We need to step up and provide swift access to accelerated approval pathway treatments because patients need and are worthy of the humanitarian aid we can provide them. Thank you.